some kinds of government orders, etc., letters. So as of now, JC sir is providing them letters telling that we are coming for the testing and all those things. But still there are some hesitations going on from though some places we see residents are ready to get tested, but the officials, the president or secretaries, they're not allowing something like those kind of things. And the second issue is now take an example. Today I get tested. So BBMP comes and takes the sample. And the results come within 24 hours to 48 hours. So after the results come, what people do is they go to a private lab after 3-4 days and they get tested and they get negative certificate. I mean, the results will be negative. So somewhere there is a message sent to everybody telling, the results are wrong and they're not giving proper results, etc., etc. So there are some medical things also which we should understand that, the test was done today and after 3 days or 2 days result was given. And after that, again, they went on a private lab and they got it tested for themselves. And then they got a negative result. There are some timelines and some, medical things which is involved where our THO and we have 2 lab representatives also to answer these questions. So these are the main 2 agendas which we are facing problems or, we want to, seek help. So I understand that there is no clarification or you guys have some questions. So based on that, we wanted to set up this meeting and clear the, whatever the negative things we have in our mind, telling that somewhere somebody else is doing wrong. So we have everybody in the same forum so that all the questions can be answered and a very clear-cut answers can be, addressed and you guys can support us. So this is a main reason why we got into this meeting. And I think Vishnu also was sending us a few messages telling that, a few apartments, they got tested, BBMP gave positive result and later they got tested in a private lab and they gave negative results. So one more thing we want to address here is whether BBMP comes and takes sample or whoever takes sample, at the end of the day, those samples are going to private labs itself. We don't have any government labs or BBMP doesn't have any any labs telling that, that is BBMP's lab. It is at the end of the day, it is private labs which has standards from ICMR and all who's doing testing. And all the labs are reputed labs which we have as of now. One is, as ma'am said, Eurofins, which is, best in the country. And second is etc. So you can, this is the main agenda. So we have people on the call to answer all the queries and we can just start. And sure. If anything is there, JC sir can tell any additional points. And Srinivas sir, who's there interacting with few of the apartments, can just tell if I missed anything so that, we can get on to the next step.
Sure. Thanks very much, Dr. Manjula and Suman. So what I will do is, so we will definitely push from our side for cooperation from all the apartments. And what I will do is I will just go through the list of questions that were entered by the, pre-entered by the people in the Google Forms. Then we'll take the questions from, let's say, people who are raising the hands here and in the chat. And then if still time is left, I have some generic questions which I've collected, which I can ask, right? So I'll go with the list if that's fine. Or JC sir, do you want to speak something from your side? Chalapati sir.
Good afternoon to everyone. So nothing, Salman and Madam has covered everything. So if anything is there, you can flag on, please. You can continue, Vishnu.
Sure, sir. Thank you. Okay, so I will go to the first question. So I've got some questions. So this is a question from Knightsbridge Apartment. Hope the Knightsbridge represents.
Vishnu, this is a question from Knightsbridge Apartment. Hope the Knightsbridge represents.
Sorry, someone interrupted. Okay, the first question is, when will BBMP start something like an open data initiative where every data point is downloadable in open formats? Especially, I think, the test results.
May I take that question?
Sure, ma'am.
See, BBMP per se doesn't have any discretion with this data sharing, but what we are trying to support is that a few of the labs, for example, Eurofin, I think, can pitch in here. They have come up with a way to inform the concerned, the way the test samples have been collected, about the test results, because positive results is something which everybody is focusing on, but at the same time, negative results are also equally important. But then we don't have, because we generally follow the government protocol, which is there in place, and it says that the positive results are announced, and of course, negative is also informed in the portal itself. But sometimes people may find it difficult to source it from the portal. Therefore, there is some communication gap, especially when it is a negative result. That we are trying to address with the help of labs itself, because Eurofin itself came up with an application where they have a means by which they can inform the patient, the person from whom the sample has been collected, if at all the result has been negative. Because as you all know, positive results are properly tracked. Those results are updated as and when the ICMR dumps the data, as and when the BBMP war room and the state war room pick it up, assign a BU number, and then all the protocol falls in place. Whereas negative somehow is getting sidelined. So that we are trying to address through this manner. That's what I think it is. But I think the others can also chip in. Suman, if you have anything, or even Eurofin, I think representative from Eurofin is there. Even they can add if there's anything more than this. Please go ahead.
Yes, actually, any results which is getting updated to or uploaded to ICMR, there's a link called as Service 1, covidwar.karnataka.gov.in/service1. In that, the results will show up whether it is positive or negative. So that is almost, if I have to be very honest, 80% of the results are coming as of now. All the negative results, 80 to 90%, all the results are showing up. And positive results, either ways we are communicating, and that is one website where we can check. So that is one thing. And Eurofins, they're sending, as of now, they started an initiative telling that in case if there is negative, they will send out a message from the Eurofins telling that, these are, the SRF ID name, and this person is negative. I'll just share that message, what is the content over there in the chat. And there's Dr. Gaurav from Eurofins. Doctor, you can just explain how exactly.
Yes, so I am Gaurav here from Eurofins. Yes, so we just started the initiative to send the people message if they are tested negative by the RT-PCR test, so that the apprehensions the patient has, so it can be it can be controlled, and we are doing it, and we are doing it very efficiently now, and we are having checks also, and we have formulated the message along with we have a talk with the BBMP people, and we shared the message and got the approval from BBMPs, and then we have started sending out those messages. So it is the way that we are trying to help to spread the message for the negative only results. And you are right, madam.
Sure, thanks for that.
Yeah, this is Dr. Venkat from Narnetralaya. Yeah, we are also working, as spoken to Srirang, we are working on the SMS platform. Once results are out, we are planning to send the SMS within 24 hours. And we are talking with the vendors. Once it is uploaded, we will send through SMS.
Okay, so even for negative?
Yes,
it's only for negative. Yes, only for negative.
Yeah, Vishnu, one moment. I was just to address, one issue here is that generally, we had issues when we spoke to you last time. Things were not so streamlined, to be frank. Results were taking more than 48 hours and, sometimes even delayed beyond that. But I would like to say that Srirang, who is involved in following with the labs and all the labs per se, I think we have about 6 labs working with us already. And everybody has streamlined this procedure so that we are able to announce results within 24 hours by and large, generally, which is completely 100% are getting announced in 90% at least are getting announced in within the 24 hours of testing. That much streamlining has been done thanks to the efforts of all the labs, and also Mr. Srirang, who is involved voluntarily. He has taken up this task and they're helping us. So those complaints of delayed results have been by and large addressed. That's what I would just like to inform everybody here. Okay, thank you. Yeah.
Sure, ma'am. Thanks. Going to the next question. This is from Professor Lakshman. So we understand and appreciate that our BBMP, in spite of their constraints, are doing a very good job in COVID test, both RAT and RT-PCR. while they convey the positive results immediately, they delay in confirming the negative. I think it's the same question. So our appeal to all concerned BBMP is to give the same priority to negative results, which we know is more than 90% in many cases. Thank you, BBMP COVID team in advance. So
I think true, Vishnu, it's more than 95. In fact, I think our positivity is about 5%. So that means 95% will be negative. We'll try to use the way Eurofin and Narayana Nitralaya have pitched in. We want to do the same thing, but the bulk is taken by Narayana, mainly Eurofin, East Point, and Narayana Nitralaya. If these three address, more than 5,000 people will be addressed. No, that is how it is going to be. Thanks. I think we'll try to ask the other labs also to follow the similar.
Ask the other labs also to follow the similar.
I think there's an echo somewhere.
Yeah.
So I hope you got the message. We'll try to rope in the other labs also to incorporate the similar messaging so that even the negative results are communicated timely.
Sure, ma'am. Yeah.
And I've just shared a sample message of negative message how the Eurofins are sending in the chat, so you guys can have a reference. And there is a link which will actually give us the result. You can check that. It's a someone had a question telling that when will they publish it, like an open forum. If they enter the SRF ID in that particular link, and there's a CAPTCHA which is involved, they will get the results out there. The link as well as the message telling that they're negative is started by Eurofins, and as Narayana told, even they're also implementing the same. And majority of our samples are going to Eurofins and Narayana, and there are small, Sakra and all those things. We will try to get it implemented as soon as possible.
Sure. Thanks. I think the next question is about, water pipes. I think we can skip this for now. We can take it offline. So I can share these questions to Chalapati sir via email. Since the topic is for COVID testing, this is also Bellandur Main Road. It's for digging.
This issues I'll talk to you, Vishnu.
Sure, sir. I will send the summary of this.
Either you can message me or we will talk about this issue.
Sure, sir.
Vishnu,
Yeah.
I think the COVID problem doesn't persist anymore. Looks like the other issues have taken over COVID.
Just one second, Vishnu, Prabhu here, just one second. To the previous question, what Madam has mentioned, I understand and agree that most of the negative results getting delayed, but in one of our case, positive result got delayed for a month. So we got a call for after a month saying that the patient is positive. We didn't take any precautions for them, but it was positive. But they try to BBMP try to come after a month when it is positive.
This is from Rohan Vasanta apartment, ma'am.
Yeah.
Prabhu Patil.
Can we get an idea when this was done, the test? Because I think about 1 month hence, I think when Mr. Srirang has taken over, by and large, things I think were streamlined. Can you please tell us when the sample was taken?
Prabhu Patil.
Sorry, I was on mute. It was collected on September 6th, madam.
I think that's the reason. I think by and large, in about 1.5 months, things have improved. See, initially what happened, our targets were only about 2 or 2,500 in the zone, but suddenly it spiked to 5,000, and now we are doing 7,800 nearly. But that is the target, but we are achieving 9,000. That is the scale of testing going on. But now things have been streamlined. I think initially that must be one of those rare cases, because it can't get delayed more than 3 or 4 days even then. But then I don't know, unfortunately, I don't know, this 1 month delay is highly, and not acceptable at all whatsoever. But then even now, whatever happened in the past, but as of now, I would like to say that, and I think even Srirang can pitch in here, 24 hours is our deadline. Though 48 hours is permitted by the government, 24 hours is our deadline. So we are trying to meet it within within the prescribed 24 hours. Can Srirang also please join in here and clarify it further?
Yes, ma'am. So actually, this can be issue with data entry, ma'am. I don't think any lab have even kept our samples for more than a month or so. This can be something like there are few smaller labs who don't have direct connectivity to ICMR. They do the manual update. Maybe some gentleman who is working on the list, he might have missed entering the data that time, and then just as they go through audit, they might have figured out that this SRFID is still pending for update or something like that. But we have not faced this kind of delay in the field, ma'am. This will be more of
during
some
that
data
time,
entry.
During that time, 2 people got tested. 1 person got a call for the positive. Second person took 1 month.
Okay. To be very honest, this was done on September 1st. And I mean, from October 1st, we made sure that, Srirang is taking care of, getting in touch with each and every labs and ensuring that the results are being announced in 24 hours.
And ensuring that the results are being announced in 24 hours.
And this is from October 1st, I can guarantee that, everybody.
From October 1st, I can guarantee that, everybody.
Those who are not speaking, kindly be on mute. There is an echo.
Those who are not speaking,
Sorry, Suman, go ahead.
Yeah, so that's, from October 1st, we ensure that the labs, we know where the samples are going, which direction is going, and what is the status of it. And Srirang is updating every day, and he's he gets on a call with labs 3 times a day and ensure that the results have been announced in 24 hours. In case if there's a delay max to max out of whatever the 9,000 or 7,000 odd RT-PCR we are doing, per day we have a pendency of only like 300 or 400. The 300 or 400, it is going into pending because there are some values which are missing, like age or phone number, not phone number, sorry, age or address or PIN code something. So that time they just keep it to pending. And but rest October 1st onwards, we have made sure that all the results have been coming out in 24 hours. Only thing is, the only fix we are trying to do now is the negative messages. In case if they're negative, that 95% messages, we thought it is going from the ICMR portal, but ICMR portal, we are not sure whether it is going completely or no, because it's entire India's portal. So that's the reason we thought, okay, we'll do it from Mahadevapura through the labs itself, and that is what we are trying to fix the problem now. So September 1st, yes, there might have been that issues, but since October 1st, from past 1 month, I don't think so. We are facing those kind of problems. So, we are not crossing more than 4 days delay. That I can ensure. Max to max is the 4 days delay we are faced. That is hardly some 10 or 15 cases. But rest, everybody is being covered within 24 to 48 hours.
Sure. Thanks, Suman. So, and next question is about, I think it's more to do with what you've said, that there are some apartments who are pushing back, saying that suggesting BBMP to publish an advisory on testing camp at an apartment. For instance, I have personally in my ward 82, so I was working with health inspector Seshagiri, and he was asking me for certain apartments where they were not cooperative, asking me to talk to them. So where I had done a bit of firefighting in terms of clarifying them, right? So I think, can we do a bit of streamlining? For instance, like I sent you one list of FAQs, right? So something like a test camp at apartment, like an advisory or with a guidelines or something like that, 2 pages advisory, so that RWS can be fully prepared and they know who is the point of contact and escalations. So there are some cases where I think a couple of wards where even they escalated, things did not get sorted out. So this question is more about, is there a possibility that we can publish an advisory, how to organize a testing camp?
I can take that question. This is Srinivas Shastri here. Vishnu, we have actually done that, giving appropriate notices to the apartments. And I'm the person who actually keep talking to all the apartments in Mahadevapura, Kayarpuram, and in Panchayat limits. So I go talk to them, tell them, and give them the thing. JC sir also gives a letter, and which has been given to them in person, signed. And what is happening is, see, the thing is like, they're very nice. They talk very nicely to me. They say yes and all that. But what is happening is, when we go for the camp, None of the residents come. They say you test our support staff, security, and go. We are going there to test the residents. But what is happening is the residents, not even one resident comes there. Probably 2 or 3 people out of 1,200. They'll say you test for the security staff, our mates. Oh, they are more prone to the virus. We are very safe. But what I have observed, or what I got to know, and a lot of people came forward and told me is that most of the mates came to me and said, "Sir, you are testing us every 20 days. Why are you not testing my owners? Even they could be the ones who will be spreading virus to us. Even our life is very critical. How is that you are avoiding the residents and not avoiding us?" So for me, as a BBMP official, everybody is same, because COVID doesn't look who is big, who is small, who is rich, who is poor, young or old. It doesn't see. Everybody needs to be get tested. Say for example, in one of the apartment, there were around 9 cases of positive, and you won't believe there were only 40 people got tested out of 1,200. So this kind of pushback is happening from the apartment side, where we are trying our best to see. And sometimes they ask, is there a mandatory letter? See, here as a BBMP side, what we are trying to do is to be more a partnership kind of relationship with the people. So we go together. That's the motto of our BBMP, to see that everybody gets involved and get tested is what we want to see.
Yes, sir. Absolutely. You're absolutely right. So I think that's an area where we need to address that. So I think in the end, maybe I want to.
Vishnu, one issue here, Vishnu. See, earlier there was an apprehension that people would come and stick a poster outside the house or barricade the apartment or the dwelling unit within the apartment. But now, since those protocols are not existing anymore, so it's only that whoever tests positive has to stay home if he's healthy and safe, and not spread to others. That's the only intention. So therefore, there should not be any hesitation from anyone to get tested. And like we already mentioned, we are also taking the sample and giving to the best labs in the country. It's not that any other, lowly labs or anything. All these are certified by ICMR. They have a proper protocols in place. They have proper manpower, reagents, everything which is as such prescribed by ICMR. So it's the same test which is done by any other private hospital if you would go to. So there should not be any hesitation in getting it tested from the BBMP team. That's all we would try to request through this forum.
Sure, ma'am. So I think in the end, I will also ask Vikram Rice and Nagaraj Rao sir's opinion. So because we've been pushing in Whitefield clusters, especially like FAQ, to clarify to many apartments who are reaching out to us. I think we should, from BAF side, we should think of an option where we can, reach this message more, to the people and clarify any of their questions, so that we can really ramp up the testing, right? So that's something that we will do.
Yeah, Vishnu, and I'm also happy to share.
To answer your question, Vishnu, regarding that, some escalations were raised and no action taken. We have one person called Abhishek. I think I had shared the number to you also.
Yes.
So he had handled some 2-3 cases when some escalations had come up. So if there's anything, you can, they can just contact him, and he'll just follow up. He'll make sure that he will talk to ma'am and JC, and he'll update what is the status, and he will give he'll give a result to you also what exactly happened on the issue raised. Like these are not like he handles the breaches and all those things as of now. But in case if there's any concerns from the apartment side, like regarding testing and someone is not cooperating or something, you can just they can just raise an escalation to him. It is related to testing, is what related to COVID is what I would like to say.
Sure. Thanks, Suman. Vikram, you were saying something.
I think once you finish these questions as well, Vishnu, happy to share some bit of, I think, some experiences from other zones and clusters as well, right? Specifically in Bomanhalli, I think some ideas have been tried, some initiatives have been tried to improve the trust and confidence level to ensure more participation. I think some of those ideas can be cross-pollinated easily. So happy to share maybe briefly, but yeah, I think we can cover those questions.
Sure.
Some thoughts I can share in it.
Sure, thanks. So I think moving to the 6th question, interest of time, I'll go a little faster. So the results are still very difficult. I think that has been addressed now. And, next question is, when do you when you do antigen and RT-PCR both, why update only one on your portal? So this is one other thing that has also happened in my apartment. It didn't happen for all cases, maybe like 1 or 2 remote cases it also happened. I think this is from SSRO Abhishek Verma. I think this is Sumadra Silver Ripples. So it so happened that if a person got tested for RAT as well as RT-PCR, they only got one SMS, right? So sometimes the second SMS of RT-PCR was missed out, right? So I mean, they were in no way to find out if they're RT-PCR positive or not. So that's one question. And the second question is, can we get a confirmation of the results through calls and or SMS? Okay, this is something that has been answered. So anyone from BBMP team wants to take this one, especially when there is RAT and RT-PCR both. Yeah. So how do we get the SMS?
I think Dr. Gaurav or Dr. Venkat can answer this because they upload the results to ICMR. And in case if sometimes RAT is done and it is negative, what is the next step they do for RT-PCR also comes for the same person or something like that?
Yes, so I am Gaurav from Eurofins. We only do RT-PCR. We are not doing RAT right now.
No. What I'm telling is, in case Suman's, if I've done an RT-PCR in my RAT and result is already uploaded telling negative, or something like that. Once an RT-PCR comes to you all, what exactly the next step is?
Okay, sir. So when we got the sample from the BBMP, we start the processing through the RT-PCR, and we first do the registration based on the SRF number that is provided by you guys, the BBMP, and then we do the isolation of the nucleic acid, basically for the viral RNA, and then we run amplification of the viral RNA. If it is there, then it becomes positive. If it's not there, then it's become negative. And if it's a negative, we send the SMS to the patient right away after uploading the results on the ICMR portal, providing the name, the age, the gender along with the SRF, so that the person is that you're tested negative for the COVID-19 test through RT-PCR, and that's it. And then they can, we also provide the link where they can download their result also if they are tested negative. So that's what we do, sir.
Yeah, I think the more question was more specifically in terms of, let's say, some cases where happen like, I think some labs where they do both RAT and RT-PCR together at the same time within the apartment, but SMS only comes for with SRFID for only one of the tests. So they're not sure, let's say they get it for the first test, but for the second test at the same instance, they don't get an SMS. So that's where they lose the track of it. So that's
Srirang, you wanted to say something. You wanted to say something.
Yeah. So actually, in the places where we do the RAT and RT-PCR both under some conditions, there will be two different SRFIDs. Now, the RAT actually is done by the PHC doctors who are there on the field, and the results are updated by the lab, the PHC doctors on the same day. So it have a different channel, and that's the reason why you get that antigen negative SMS immediately, because that is entered by the BBMP doctors immediately. However, the RT-PCR sample will go to the respective labs where they are being mapped. And like we said, it takes about 24 hours for them to process the thing. And after that, the result will be coming. Now that area, we know that, right? RT-PCR negative SMSs are not coming. We are working on that. But that's the reason why you are getting, message for antigen negative, because that was entered by the BBMP doctor. And the RT-PCR negative it is not lost. It is just that, it is taking time. You can go on the Service One portal and 80% of the time it will show up there. And in some days, anyway, the message will start coming to that. But the discrepancy is not between the RAT and RT-PCR. It's a different flow in the background.
Okay. Yep.
I hope that answers.
Sure. Yeah. The next question is from Gopalan Habitat. So what is the expected
Vishnu,
turnaround?
I want to clarify a little bit more on what Srirang has said. So basically what we do is when we come for a camp, based on the symptoms, we do the RAT immediately there to identify whether the person is positive or not, because the RAT immediately gives you the result. And what is happening currently is RAT is not exactly the right channel to identify a person is positive or not. So even if you have a symptoms, and if the negative report comes from the RAT, we do the RT-PCR. The reason what happens is when we upload the RT-PCR result, which is the right result for a patient to understand whether it is positive or not. Because sometimes what happens is when a patient gets negative on the RAT and positive on the RT-PCR, there will be a conflict saying that, see, one result is showing negative and the other result is showing positive. Basically, what we do is we avoid RAT for asymptomatic patients.
Got it. Yeah. Thanks, Suman. So the next question is from Gopalan, Habitat Splendor. So what is the expected turnaround time for getting tested for COVID on contacting Aptamitra helpline for a suspected COVID suspected person, right? So
I can take that question.
Sure.
Hello, Srinivas?
Yes, ma'am. Go ahead. Go ahead, ma'am.
No, you go ahead. Let me, because I was not very clear. You go ahead. Let me see.
Okay,
what
ma'am.
I understood, and you are asking.
So I think what they are saying is, suppose if we suspect some person has some symptoms and we call Aptamitra to get them tested, for COVID positive or negative. So that's how quickly.
Let me clarify, Vishnu. There is no testing directly from Aptamitra. Aptamitra is only asking us if there is any symptoms, and they have to, advise the, if the doctor, if the symptoms are there, and the doctor picks it up, and then they advise you what has to be done. But there's nothing as such, they would recommend you or ask somebody else to come and get in touch with you for a testing. So that is how it is. I don't think there's any such system in place, but they would advise you to test yourself or go to a hospital or even call up 108. These kind of things they would definitely say. But there's no, typically, I don't think there is a, expected protocol which runs, once the Aptamitra is called and something has been advised to you, there is no system which falls in place. So the best thing to do is anybody has a symptom, is get tested, because BBMP is doing anyway testing in random places. But apart from that, your nearest PHC is always a fever clinic where 24/7 you should get help. Or if not 24/7, at least till 6 o'clock or 5:30 reasonable times, you will have taking your sample. That is fairly available. Or even worse scenario, you can always call up the call center, which we will arrange. If somebody can't walk up to the fever clinic or go and travel to the fever clinic, then at least we can commute to the fever clinic. At least we can go and collect the sample from home. That facility is possible.
Sure.
So
That
I think
happened.
this is how it is. But yeah, Srinivas, yeah.
Yes, ma'am. You are right. Actually, Aptamitra is only to advise the patient on what they need to do next. But there is no direct link of advising them to arranging for a swab test. So they only advise, as you said correctly, that they need to go to the nearest PHC where they can go and get it tested.
Yeah.
Since we have a proper forum, Vishnu, we can always call up the call center, and now there is facility 24/7. Our call center works, and we are deploying so much of manpower there. If there's any issue, somebody wants a testing to be undertaken even at home, we can always go and pick up the sample. That is there from our side. We are ready to do it, whatever cost it may be. We are ready to do it. So everybody should feel comfortable to call up the call center if there's any such need as such. No need to panic and run to any private clinic or a lab. We can always do it because we are also getting tested from the same very labs, which would also be done by the private testing centers.
Sure, ma'am. That is true. So I think just to add a personal experience, in our apartment, we had done a couple of tests in the same way, where there was an infant and just a mother. They could not go out. They wanted the test to be done immediately, and within a couple of hours, the PHC team from ward number 82, they visited the apartment and they made sure that they've done both RAT and RT-PCR tests. So that is right. The next question is, what is the expected turnaround time for getting the hospital admission for a person on home quarantine if the symptoms have worsened suddenly? Again, in my personal experience, within 1 to 2 hours, we got the person admitted in hospital. The time when we call the Aptamitra helpline or the Mahadevapura COVID zonal helpline with the BU number and asking for which hospital, etc. So the total turnaround time was for 2 hours in our case, but I think, yeah, BBMP team can answer
better. I think Vishnu, yes, correct. You are right. See, when the beds availability and the appropriate bed for the patient is readily available, it's very easy, because all that we have to do is block the bed, And as you all know, there is a real-time updation of the bed availability, which gets reflected in your call center, command center. So there is something called a COVID hospital bed management system, which has both the bed details of both the private hospitals and the government hospitals where we have, taken over the COVID beds. So these beds, like you all know, have oxygen beds, ventilator beds, ICU beds, and general beds. All categories of beds are readily available. So whenever the situation has plenty of, or at least available beds of the patient's choice, generally sometimes patients also demand that it should be near to their homes and things like that, or near to the preferential hospital and all, in the preferential hospital and all that. So then sometimes there can be a delay, but otherwise, as of now, like the real situation is far better than what it was about 3-4 weeks back. I think bed availability is quite eased out now, and then there is a good rapport between the hospitals and the command centers also, and that way I think we have been able to facilitate hospital bed according to the requirement, clinical requirement of the patient. By and large, like you said, 1 or 2 hours or maximum 2 to 3 hours, we should be able to facilitate. I think that is going on also, including picking up from with our own ambulance. Even that is possible. So if anybody else has anything else, Apeksha, I think, is here. Apeksha can add something here.
May I come in? May I come in
Yes,
for a
ma'am.
minute? Vishnu?
Yeah.
Vishnu?
Sure, sir.
Yes,
Yeah.
yes,
Yeah.
please.
Vishnu, may I come in?
Yes.
Yeah. Dr. Manjula madam, I am Professor Lakshman, and my video also has been forwarded to you. And my experience, I have made it very clear. BBMP was very prompt, and they called me, even told me, you are a senior citizen, we can arrange for hospital. I am the president of Kirti Flora, as well as cluster council president of Whitefield 1 and 2. And my video has become viral, and I was told by Vishnu, he has forwarded to you. I would like to make it very clear. My experience with the BBMP was absolutely fine. I can even quote here on behalf of Trifactor, as well as by ACME, as well as Kirti Flora, where we have conducted more than 3 tests by BBMP, and we had no issue. In fact, BBMP test team remarked to our central quarantine team, which is almost a medical background. My own background is more than 50 years on healthcare, Medicare, and surgery care. And we extended such a help, and BBMP also thanked us that nowhere we have been given so much of breakfast or lunch or whatever you want. So I would like to appeal to all our Resident Welfare Association or Bangalore Apartment Federation members to, on our side, let us walk a mile extra towards BBMP. Let us try to do our best. And I am sure there won't be an issue. I could understand what you are talking about earlier, September. By and large, there could be here and there, as Prabhu Patil pointed out. But I have made some study from October 1st onwards, and I have my own statistic, Vishnu. More than 400 tests have been conducted in Whitefield 1 and 2, and in that, hardly 4% came positive, and including, I'm talking about PCR test. The only question which I raised was the agony by getting delay by negative results creates an issue, and I understand Vikram also brought it to the attention of Dr. Manivannan in the other discussion. So that point needs to be taken. Otherwise, by and large, we are quite happy with BBMP. Thank you, Vishnu. Thank you, Dr. Manjula.
Thank you very much, sir. I think your words are very inspiring and encouraging also, because, behind the scenes, there are a lot of officers and staff working day in and day out. You won't believe. And this they have been sustaining for the last 4 to 5 months. Everybody is under immense pressure and everybody is fatigued, but still we are trying to do our best. I think your words are very encouraging, and we'll try to continue our work.
Can I ask you not a place to ask, but you had the occasion to see my video?
Sorry? No, I will watch it now that you mentioned. Sorry, I had no idea.
I can tell you, madam, if you watch my video, I'm 74 years young fellow with more than 54 years of experience in medical line, surgical line, and you can see how I have covered the whole thing. And under our e-mag also, magazine which we are releasing every month, I have written the write-up also, starting with Mahatma Gandhi's quoting of indomitable spirit and ending with our Prime Minister's, let us not bring down our, let continue to be on that. Please have a watch. If you watch my video, I'm sure you will start putting it into a war room. And it has been seen already by more than nearing almost 2,000 people. So my only
Okay,
request
thank you,
is,
sir. Yeah, thank you, sir. We will
Sure.
watch it.
Thanks.
We will watch it.
Yeah,
Vishnu?
thank you, Professor. Yeah, sure.
No, my idea is not to rise my collar, madam. My idea is only to make sure that apartments also need to walk a mile extra, and apartment also have to realize with the 200 members in an apartment, management committee find it difficult to answer. When you are doing 7 tests today, how difficult it is, what is the logistics available, what are the constraints available, that has to be understood by our Bangalore apartment members as well. That's my only request.
Sure, Uncle. Sure. Thank you. So in the interest of time, we are at the top of the hour. Yeah. Thank you. So we'll just see a few questions from the chat and also any open questions also. So let me just quickly go through some of those. So this is a thank you note from Paramount Raghavendra Apartment. So they have done multiple rounds of testing, and Mr. Srinivas, nodal officer for testing, he was readily acknowledged, and we got a camp within 24 hours. And this is a thank you message. And this is, I'm not sure from whom, many people do not get SRF itself, SRF numbers. So this is something that we need to check. Call center helpline number, please. So this is something that 14410 for Aptamitra. And if you Google for BBMP zonal, let's say contact numbers, you will find for Mahadevapura Zone as well. Mr. Shantaram from Windmills of Your Mind, what is the current bed capacity of COVID and what is the occupancy rate? So this is something that I was trying to find out. That link, somehow it was not available in Google, but if you just Google, you can find BBMP COVID bed status. It's a live bed status, which clearly indicates how many beds are available and how many are already occupied, right? So that is something that is easily available on the Google with a live update. And website for hospital bed availability. And anyone can raise any other questions. So in the meantime, I'll just paste it because since a couple of people have.
One request,
Vishnu?
madam.
Yeah, Vishnu, I just like to mention that, yes, correct, you are right when you said that it is a real-time updation of the bed status. But please remember that there are a lot of issues with the private hospitals also. Not many would like to, spare their beds to the government or the BBMP quota. There is always a clamor to, to give it to their private patients. So there's a lot of effort which goes in. In fact, I would like to inform here that we have appointed a nodal officer who is either from the BESCOM or BWSSB to every hospital which is more than 100 bedded, and 2 or 3 hospitals which are less than 100 bedded. So we have a nodal officer who is appointed for every hospital, and if there's any issue, we are trying to manually sort it out with them. That is the scale of involvement of BBMP and the government at the hospital bed allocation also. Though they are supposed to frankly declare immediately once a patient is discharged, a BBMP patient suppose occupying a government bed is discharged, immediately it should be shown as available. But many times we find that these beds are not really, declared as available, and sometimes the private patients have been appointed, admitted. These kind of issues have happened, but I think things have become better of late, and these things are, little more better streamlined actually, and there is much more cooperation from the private hospitals also. But there were a lot of issues in the beginning. That is when we used to find that the reality would never be seen on the real-time, status availability. So these issues are there, like you all understand. These are issues which are there, practical problems. But then we are trying to overcome. But in spite of all this, we have a Arogya Mitra who is from the Suvarna Arogya Suraksha Trust, appointed to every hospital which is 100 bedded and above. And also we have one nodal officer from BESCOM or BWSSB who is there appointed. And through them we were trying to, and in fact we have gone to the lens of police involved in some cases where there was a lot of resistance. But I think last 1.5 months, I think things have become pretty streamlined.
Sure, ma'am. Thanks a lot for that. So this is the link of the, let's say, bed status, which I've shared. So you can see the live status. Yeah, sorry. Someone else was speaking.
Vishnu, just one request to madam. See, each representative apartment if I can able to get the consolidated reports, like positive or negative, would be helpful, because I have conducted around 4 or 5 rounds till now in my apartment, Santa. Finally, I got with a lot of follow-ups. I got the report, but many apartments representative wanted to know the consolidated report on their own so that they can take required action.
Yes, ma'am. So I think this is.
Yeah,
sorry to interrupt.
Yeah.
So this is a similar request that I got from Brigade Metropolis as well.
Vishnu, I also have a question to say. So
Yeah,
they
Dr. Purnima. Yeah, please.
last week also they had come and actually they were in September end about a week. The BBMP doctors came and they did the testing and all that. But as usual, the testing reports are very late, especially from. I'm sorry, Gaurav, but from your lab, the testing took 7 to 8 days to come for our people, and we had to then sanitize the whole area and get everything done again, and I have to ask them to quarantine. I don't know where the missing is. All the information was given. The personal information, whatever has to be given, was given. And even last week also we had the same problem. See, if it is negative, I don't care. But if it is positive, please, I know we have been talking about this, and I know there's a lot of pressure and excessive samples coming in. But it's just that I don't want some of the samples being wasted after taking in and not testing it properly, or not, I mean, whatever. There are chances of error also in the labs, and we cannot never say that everything is pristine. Being medical doctor myself, so I just want to make sure that, because this COVID has become a kind of a talk of the day, even though now it is coming down, but still people are fearful. So before we go testing, it's better somebody from the BBMP. I had a sincere request from all the BBMP doctors, zonal doctors, to come and educate the residents first before you come and start the camp. Because many people, even though they are educated, are scared of this being, positive, and people don't talk to you, or they get quarantined and then nobody's there to take care of them. All this, they have this illusions of all those things. Some may be true, some may not be true. So I just want them to come before they come for testing. The letter and all, I don't know who reads and who doesn't read, but it's better they come give us by Zoom, or just come and tell us
Yeah,
a day
Dr.
before.
Purnima, sorry to interrupt. So maybe we can do, one of the ways is, so we have the previous meeting was also done where we have, let's say, done the recording, right? So whatever we are speaking now also is being recorded, and it will be available on YouTube. So the same link can be shared to people, and some of the FAQs, and that's one thing, and testing must be addressed. So by the way, Dr. Purnima is from Prestige Shantiniketan, and we also have people from Brigade Metropolis on the call. So the big apartments, there were some apprehensions, and especially since the testing numbers will be large, so they were demanding, let's say, for the whole Excel report for each day, let's say if they're testing more, etc. So that's a request from large apartments.
Vishnu, can I come in? Vishnu?
Sure.
Wonder,
Okay, Vishnu.
Vishnu,
Yes,
I would just wonder that if positive results can be given away as a consolidated list. That is not possible, because the positive patients have to be informed directly. It's not. In fact, we can't declare any positive results as such. But negative results, we'll try to see if it can be possible, since the negative results are always compiled in each lab, and they have the capacity, and already they are trying to send an individual SMS that we can see. But positive, I don't think we have the wherewithal or nor the authority to declare it in public or give it as a consolidated. It's not possible. It's patient privacy issues. So we cannot do that. It will only go to the concerned patient. That let be clear. But apart from that, I think it's very good suggestion which doctor said just now, that we should also talk to the people who are residing there. So educate them, and before doing the testing, try to solve their doubts in their mind. That we can definitely do. I think we should do it also. It's just that please understand that we are also running against time, and the targets have been jumping week after week. For example, I would just like mention that we were about 2,000 was the target designated 1.5 months back. It jumped to 4,000, 5,000, 7,000, 6,000. Now it's 7,700.
Hello.
Yeah, Vishnu, see, Dr. Purnima madam, see, there is a myth and reality in this issue of, when that is their apartment president and others come into picture. I appreciate Dr. Manjula madam, in spite of all the constraints, she accepted, she said she will try to send BBMP
Vishnu?
official to talk about.
Yes, ma'am. Manjula, ma'am, you are back now.
Yeah,
Go
I
ahead.
thought, no, I got, yeah, basically I was saying that it's difficult to, because of the increasing targets, we found it difficult to actually give enough time, but we definitely acknowledge that, yes, we have to consult people, clear the doubts in their minds before we actually do testing, but we will try to solve those issues. We'll try to, get together with you people and then try to, address those issues also before we start testing. That I think we should try from our end when we'll do it. But kindly cooperate with us, because mentioned the targets have been jumping by thousands every week, because every Sunday we get a revision of target. That is how it is, based on the number of positive cases which are reflected in the week. That is how the targets are given. So there has been some problem. We couldn't scale up immediately because it's a exercise, and also mobilizing manpower, resources, etc. for the testing is a big challenge. But anyway, with all your support and everybody's support here, we have been able to achieve 9,000, which is not an easy task. We'll try to help you. We'll try to get in touch with you people and consult you and try to allay all the fears and doubts, and then we'll do the testing. We will do that.
Yeah,
And
Vishnu,
Dr.
I just wanted to inform Dr. Purnima Madam, when you take our Vishnu apartment of Trifecta with just 172 flats, they have done more than 400 tests. So it is apartment president, secretary also need to play a role and explain to the people. There will be always doubting Thomas, cat sitting on the wall. So it is apartment management committee responsible as well. And as Vishnu said, things are all being recorded, and that could be in the YouTube, that can be shared with our apartment people. Especially, I do understand the PSM with 3,000 plus flats, that could be issue. But again, I repeat, we also.
Sorry to interrupt you, Uncle. We have been doing it almost from September midweek onwards. We're getting it done almost weekly. They're coming and doing it. We are having camp almost every alternate week.
Sorry to interrupt. I think other apartments also need to raise their concerns. Dinkar from Sterling Brookside.
1 second. Dr.
Vishnu.
If you need any help from my side, you can always call me, and you can I have my number should be there when the participants. I'll also
Thank you, doctor.
Thank you.
We will get in touch with you. Thank you. Yeah, Vishnu.
Thank you, sir. Yeah, this is Dinkar from Sterling Brookside. We had an inspection, but it happened without notice, so we couldn't let the residents know. We were just given 2 hours in which we were able to get at least the security staff tested. So my request is, if the schedule can be published earlier and little more time allocated per apartment, we'll make sure that residents are also getting tested. As you raised the concern that maids and security say that residents should also get tested because they are also residents, to be equitable testing. We are open, but if my request is, if a schedule can be can be announced earlier, so we can be ready, and a longer duration be assigned. Thank you.
Definitely, sir. From Sterling Apartments, thanks to you, we are ready to do it. In fact, you have to schedule it for us. So we don't schedule it. Whenever you are comfortable, you can let us know. I think Google spreadsheet was shared, but even if you are not aware of it, I think Mr. Suman is here, who would again do it once again for everybody's benefit. And I think Vishnu is also well aware of it. So you have to schedule, and then we will be there whenever it's comfortable for you. That's how it is.
Thank you so much. I'll coordinate with them. Thanks a lot for the support.
Vishnu,
I'm sharing the Google Form link now. You can just copy it for reference.
Yeah, I wanted to second Professor Lakshman's idea that you kindly get in touch with the president and secretaries. You can't get in touch with 1,400 people, but the responsibility of the president and secretaries and the MC members will also have to be taken to communicate, to disseminate the particular information among all the residents. Secondly, where there is a percentage of positive cases more, I think we may have to foresee that many of the people will have to get tested. These are my opinion. Thank you.
Sure. Thank you, Nagaraj sir. So,
Vishnu, there's Burhan. Can I ask a question?
Burhan, I just want to. I think I'm just going through the chat as well. I think there were a couple of outstanding questions from
Sure.
the
Please
chat,
let
and
me
then
know.
we go for the free round. So this is from Govindam Apartments. I think they asked. This is from I think the other side of Marathalli Bridge. Maybe they come in Belandur cluster. So they said that they got the pics from the next door apartments, Atco Palms, and they said they denied having a camp. So I think they were not trustworthy with BBMP. So Jaya, I can say that we will circulate the link again where you could request for a slot, and let's get the test done. And next question is, this is Rampriya from Sriram Spandan. We would like to know who we should call in case of residents wants to verify the latest norms of BBMP. There seems to be a delay in Kannada or English SOP taken to zonal authorities. Is there a helpline for RWA, like what to implement and what norms to follow? Ma'am, this is for, let's say, COVID management or any SOPs where they can call and clarify some questions. So is there some point of contact from BBMP? Manjula ma'am and BBMP team?
Yeah, Vishnu, I can answer that. So there is a helpline number called 230-10101 or 102.
Okay.
So there you can get the information what is required, and all the SOPs are in public domain, which can be accessed there. And any questions related to the home isolation or home quarantine, you can call the helpline number and they can guide you to the right SOPs there.
So this is Rampriya here. Thank you, sir, for taking the question. This is based on an experience that we had, especially during the time that the new SOPs comes up, right? During that time, there seems to be very less clarity on what is required. But we were in touch with one person who assured that we could go ahead and remove the barricades and things like that. But from a resident point of view, there is always, in apartments, one group that says that, no barricades, and the other group that wants barricades and people to be isolated. So it's just a feedback. If our helpline numbers can be intimated about the changes that are going to be implemented, because they would start getting calls on that day, right? So we had a very bad experience where we were not able to decide, and that delay caused a lot of unrest, and especially because the COVID is a lot of stigma associated with it. It was a very difficult phase for us to sort of face the residents. So just raising that, we will call this number, sir. Thank you.
Yeah, ma'am, thank you for the feedback. I understand, because it's like you all know, a lot of the changes or the SOPs which kept changing so frequently then. But now I think by and large it's been streamlined, and by and large all those restrictions and barricading have been removed. To that extent, a lot of fears and that hesitation has been, taken care of. But then we'll keep this in mind. But only for us, it's difficult to communicate with every channel. But then if there is one stop, where everything can be communicated, it's easier. We could as well post all the government orders which come there. But even otherwise, the health department has put every on its website. So it's easily available to everybody if there is a doubt in mind.
Yes.
Sure.
So if
Also,
this testing SOP came to us, there were little, we were not clear. And then by the time we could get clarity, somebody from BBMP had called up randomly and asked for testing. And we had literally, the resident had to shoo them off because they didn't know what to expect. So like Dr. Who pointed out earlier, if we have like a campaign from BBMP saying we are going to come testing to apartments and sort of set the stage, that will be helpful for us to say, yes, it's a valid, and it is it is not a scam. Basically, that is the biggest challenge that we are facing.
Ma'am, just to answer your question, as Suman also said, that there is a Google Sheet where you can share and tell us when you want the camp. We come and do the camp. See, we on our own don't come and force you to get the test. But we generally, when we come around that side, we generally talk to the association presidents saying that we would like to do the test and all that, and then give an option for them to decide on the date and the number. What is happening for us, major challenge for us is you say there are 400 people to be tested and you give us in an Excel in the Google sheet. When we come there, we end up only testing around 10 or 15 people. So that's our major challenge, which is currently happening with the apartment people.
Got it. So we will address that from BAF side also. So we'll reiterate to everyone, and we'll support to the best extent possible. And
Just to add one thing, Vishnu, is
sure,
regarding Prashesh Shantiniketan. Myself personally was there for almost 3 camps there. And in the last camp, what happened was like they asked us to come and do the testing. We went on that day, and you won't believe there were exactly 7 people who came, and all 7 were only security. None of the residents turned up, and we waited from 9 o'clock to 3 o'clock. 7 people turned up. That is only security. Not one resident came. Being 7,000 people in Prashesh Shantiniketan, going to each person will be very difficult. We assume that the association will take the respective question and answers. And I was present for them to be answered any questions regarding testing or if they have any queries. I was there. So anything, they can just call me and I can be more than happy to help them.
Yeah, sure. Sure, Srinivas. So what I will do in the interest of time.
Yeah, in the interest of time, we are all on the field actually.
Yeah,
and,
yeah.
If we can just end it, I'm actually standing in the road and taking the call.
Oh, okay, so
we can
sorry.
in 10 minutes. I mean,
within 9 minutes,
everybody's
Yeah, sure. Let's give it 9 minutes and let's close it. So just to conclude, Srinivas sir, I will share Dr. Purnima from Prestige Chandriketan MC to Suman, and you could, I can bridge you and we can do something better for PSN. And there are 4 last questions, so we end sharply at 5:30 in the interest of time, and that to being on a Sunday. So Sridhar, since you've been raising from 30 minutes, over to you quickly, please.
Yeah, thank you, Vishnu. This is Sridhar from Lakeshore Home. I'm also president of the cluster here for Belandur Gate. I have a suggestion which I've actually put down, which is that as a coordinator who organized 2 BBMP testing camps here, I get bombarded with queries from my residents saying, where are my results? So I don't want to get into why negative results are being delayed. I know you people are addressing it. My request is consolidated manner, the negative results alone, if you can communicate simultaneously to the coordinator you have, people like me, then it helps us. Even if individuals don't get, we are able to handle this. So please consider that. And then within BAF, I have a suggestion. Within BAF, I also seen a lot of reluctance on part of residents to come forth and do the testing. So I think within BAF, for my cluster at least, I would like to actually get in touch with each individual MC office bearers and ask them what their objections are and try to win them over. So I'm trying to get my team of cluster leaders to get them interested to probe and question the individual BAF resident community. I think we ourselves within BAF have a lot of work to do to ensure that we have people ready for testing when Mr. Srinivas Shastri's team comes over. That's it from my side.
Sure, Sridhar. Dr. Venkat and Burhan and Lata. So 3 questions. Yeah. So hand was raised. So
yeah, same thing. I want to explain already. I already given my concern about PSN.
And also, we would like to know the Bomnalli ideas. I mean, I think someone wanted.
Vikram Rai was saying. So I think we'll take one question from Burhan. I think Dr. Lata, I'll take your questions offline. So Burhan, you had a final question, right? So please raise. Then we ask Vikram to speak from the Bomnalli experience. Yeah.
Sure. Okay. Hey, guys, thank you very much. Appreciate for allowing this question. Question to BBMP team. It is not a question, but it is more of advice that how do we tackle situation which I'm about to narrate. We had 2 tests in our apartment. The first test was having around 80 odd resident and around 25 odd support staff. First time around, we got 4 positive, all were support staff. Second time, we had around 50 odd case test. In that 30 to 35 were residents, other were support staff. So again, support staff were not very high. Yeah, definitely it was higher compared to the last time. The second time around, we got 6 positive. All of them were support staff. So that raised the question to support staff saying that, okay, hey, only we are getting positive. I understand that definitely like there could be right reasons for that particular kind of results, but that raised certain kind of doubts or stigma to the support staff. And now definitely they are a little hesitant because fortunate and unfortunate, none of the time, both the time, no residents were positive, though the number of residents went for a test were very significantly high. But support staff which were lower in number, only X%, around 10% also they got positive and only limited to them. So the question is that situation like this, how do we take it forward and handle it?
Okay, I'll take the question for that. This is Srinivas Sastry here. Buran, to answer your question, see, it is not about the percentage of how many support staff getting positive or the residents getting positive. The idea is that, see, if you people come forward and test, that gives confidence even for the support staff saying that when my owner is testing, why should not I get tested? And not only that, see, I've seen a lot of cases where people have come forward. I'm not saying that people haven't come forward. The residents have come forward, taken care of even the support staff when they got positive. And we have supported them fully, 100%, 24/7 we supported them. So the purpose of when we come to the residents' apartments to test is for the residents' priority, not the support staff or the security. The support staff and security can actually come later. It's only the add-ons to what residents wants to do. But our main focus when we come to resident apartments is to test the residents and later on do the testing for support staff.
Yeah, we are doing testing for the support staff. Some apartments have their own, place where all the support staffs are residing in one cluster and all those things. We are getting them tested in those camps also. But main agenda for apartments is, we are just trying to safeguard. So there are situations where, sometimes even we felt bad. Like this is in Hindi. There was two, three people asked, मेरे मालकिन को क्यों नहीं कर रहे हो, हम लोगों को क्यों कर रहे हो? So this is how they asked us the question. So sometimes, we couldn't answer anything there that time. So
yeah,
I mean,
absolutely, those are the valid concerns here. The situation which I'm saying is that 80% residents, 10 or 15% support staff, and when only those support staff get positive, that kind of makes them feel that, is this right? So I understand, it is definitely, there is no doubt, it is something which we repeatedly discuss in this call.
Burhan.
Yes,
Burhan,
please.
I think now I got the question. So I will just say one simple thing. As soon as the sample leaves the your corridor, nobody knows who is support staff and who is the resident, right? So there is no discrimination in the results or anything like that. If they are more exposed to the risk, that's the reason why they are turning out more positive, is what we can conclude out of it. Because at the end of the day, it is just a sample once it leaves your premises. So we might want to counsel them, make them understand how they are more exposed to the environment and how they are on higher risk than the residents who are living inside. But that is it. I don't see any reason why it can happen otherwise.
And sometimes it might so happen that the place they work also, if they're support staff, if they're working in some some apartment, say number 301, that person might be a positive guy, but he wouldn't have had symptoms. He didn't get tested, so he's just staying there. And this fellow got tested and he's asymptomatic, and we found out that he has the virus. So these are the situations also might be there. And as Sri Lanka rightly told, once the sample goes inside a box in the same apartment, it will not know whether it is he's an apartment owner or he's a facility guy or whoever it is. So that is what it is. For the lab people also, they don't know anything. They get sample, they test and they send it. That's all.
Suman, what you said is right. What you said is right. How does it matter? Infection could be the other way around also. The dwelling owner and the dwelling unit owner could be actually transmitting it to the support staff or somebody, because like you all know, 85 to 90% cases are all asymptomatic. And I think more so in India, the symptomatic cases are very less. I mean, in the sense, the percentage wise, it's pretty less. And now the infection is also kind of waning. The wave is also waning off. So therefore, I think it is all the more. See, the basic point is that the earlier you detect, the earlier the patient can be isolated, so he'll stop spreading. Second thing is, the earlier you detect, and if the person is say, symptomatic, and he can be addressed, he can be shifted to a hospital, or he can get medical attention. That helps the person himself and his family. So there's no discrimination as such. I don't think we should be differentiating between the people getting positive on the reason that they were only the supporting staff or things like that. Those kind of doubts, I think, are unwarranted. Everybody should get tested for their own and their own family's sake. That's all I can say.
Thank you, guys. So this is something which we definitely explained. And just for a clarification, most of the support staff whom I'm talking about are either security or a car cleaning guy. Whatever explanation which I got to understand, that is what we originally thought of, and we explained the same thing to whoever got positive as a part of a test. So appreciate for clarification and giving detail on that. Thank you.
Vishnu?
We are unable to hear you.
Yeah. Vishnu? Vishnu, am I audible? I
Yes,
think
ma'am,
Vishnu
you're
can
audible.
conclude it now. Yeah, if there's no other issues, we can just listen to the experience in Bommanalli so that we can have some learning and some takeaway from there.
Yeah,
Yes, Vikram. Yeah.
Sorry. Yeah, I think in the interest of time, but very quickly, thanks, Dr. Manjula Chalapati sir and the entire team. I think it was extremely useful. I think everybody has their own experiences, which is enriching all of us, sir. Right? I think let me take 2 or 3 minutes quickly to share some of the experiences from the Bommanalli zone side, where we have also had an opportunity to collaborate with the BBMP team there. I think broadly classified into 3 parts, where we were also able to collect information about where the process can be optimized, better efficiency can be built, and most importantly, how can trust be built for more people to participate, kind of stuff, right? So 3 parts. One is, I think, following an approach of creating a more clear scheduling process, right, helps a lot. We had initially got a lot of input on there being teams landing up unannounced. People are not prepared, they have not communicated, etc. So I think Suman already mentioned that there is a Google Sheet, etc. being followed. I think, Vishnu, we should take that up a little bit more proactively, where everybody gets that schedule fixed. In fact, in Bommanalli, what we are trying to do is every week, I think one slot is every apartment is sort of trying to fit in. So if I am an apartment which is on a Monday, I have an 8 to 9:30. Next Monday, I could be 11 to 12:30 subsequent. So they are trying to see if we can fit it into a weekly schedule as well. Of course, numbers, etc. allowing, but the idea being that in an apartment, that every certain day of the week, during a certain slot, there will be a 90-minute camp where people can quickly go and test it. So it's almost to make it a part of your life, right? Because people are going out to work now, there is risk, etc. It's out in the community. So making testing a part of your life in a pre-scheduled manner, right, I think is adding a lot of help for people to know that, this is not like suddenly somebody coming in, but there's a preset schedule. I can get myself tested anytime that I think maybe it is important for me to go and get tested. I think scheduling, we will need to put a little bit more focus so that the preparedness can be ensured better. That's point number 1. Second is, I think, communication and trust building, right? I think we're putting a lot of focus over there, because a lot of lack of clarity was there on what kind of test is being used, when is RAT used, when is RT-PCR used, some kind of challenges with the results of RAT being used. Certain residents had got RAT done, which was positive, but went and then did a RT-PCR, which was negative. So that created a little bit of confusion. So then how does the test samples, where does it get taken, which labs, how long does it take, etc. A lot of confusion around that. I think in this kind of a forum, we are sitting here, and I think most of us are reasonably aware of that process, back-end process, but I think the general janta is not so very well aware, and that's where all the confusion and trust deficit comes up. Then they start following their own WhatsApp forward saying this lab, BAO, and all that kind of stuff, right? So I think that is one more piece where awareness needs to be brought in. Reporting is one more area where awareness needs to be brought in. So what we are trying to do in Bomanali is to create very small, simple communication toolkit. One, I think a poster was created which just explains this process of what happens when a camp happens, and how does the sample go, where does it go, how much time report comes back. Just a cyclical process definition of how the testing camp then proceeds until the results come, right? I think simple process definition poster. I think Vishnu, you mentioned about FAQ. I think something can be put pictorially, nothing like it, right? People don't read documents. Let's be very clear about it, right? You and me know how much documents can get sent, but nobody reads it. A simple poster can, I think, do the job, which just explains the process of what happens to samples, how results comes back, etc. And in fact, very glad to have, I think, people from the partners, lab partners also participating in this call. Kudos to them. I think they have come and clarified their position and the process that they are following. I think one poster, we are also here in Bomanali, one small video is getting done, which is just testimonials from apartments. There are apartments like Adarsh Rhythm, etc. and all, who have now conducted 5 or 6 rounds of testing with great success, great results. So we are also collecting testimonials from the apartment president or secretary to stitch it into a small AV so that can get circulated as well. In one of the wards over here in Gottigere, actually they're actually doing something called a health talk. I think that idea came up in this discussion as well, where the BBMP team is actually going and conducting a short conversation and a talk, right? Giving them awareness about what happens, what is the testing, why is it now important to do that, etc. Gottigere is doing actually health talk already. One more idea which we might kickstart next week is like a weekly call, something like this, where it's a pre-designated time slot, right? Once a week, where 1 hour maybe, right? Where anybody who's gone through testing, any reports, challenges, etc., have an opportunity to come and ask questions. It's just a quick half an hour to 45 minutes of just question answers clarifying, right? So a bunch of communication ideas, which is poster, AV, video, health talk, and an ask me anything weekly call kind of schedule, right, is all being implemented to get more and more information flowing, and hence more and more trust coming along. Of course, we have done a lot of discussion around reporting and predictability. I believe that in all the parts across Bangalore today, in the last 1 month, tremendous amount of heavy lifting has been done from the BBMP team on bringing more and more predictability and clarity on testing results. I think RT-PCR results, at least here, most of the places, 24 hours to 48 hours, maximum the results are coming. Few here and there might be cases might be there. But on an average, I think 90+%, 95%, the timing of the reports is happening and it is coming in as well. So I would like to believe that putting a little bit more effort, and their BAF, I think, Vishnu, we should also put our effort to collaborate and create a little bit more communication for trust building. I think will go a long way in ensuring that more resident participation happens. I think today the resident participation is not happening, and that point came up. I think the staff are being forced to test, right? And they are valid in asking the question, saying that why are they only being asking to test, right? We are equally risky for everybody else. So residents should also come out. But the problem is, I think the residents need more information. They are asking more questions and they need to be fed, right, on that part. I think that if we take one more step forward, I think there will be a much more positive response on that. So thank you so much. I think Dr. Manjula and team, fantastic.
Vikram, can you hear me? Am I audible?
Yes,
okay. Yeah. Thanks a lot. I think we are already over time. So thanks a lot, Vikram. Any final words from Manjula ma'am and team? Otherwise, thanks a lot from everyone. Ma'am, over to you. Yeah.
Vishnu, thank you very much. I think Vikram had some valid points also. Yes, we agree that communication is very important, because we assume that everybody would have read up the circulars or everybody would have read up the advisories. It's not possible. And there will be some practical issues also, like in the field. We will also try to, copy what Bomanali is also trying to do. So I think we will try to bridge the gap. Somewhere the communication gap has to be bridged. But we have a good team through you, Vishnu, yourself, and your federation, and also our volunteer participants who are there, Suman and Dr. Srinivas and Srirang. They're all doing a good job. We will use these bridges to, reach out to you, and we will try to do the best possible, clarify the maximum possible from our end. We'll try to do that. But I think you all have been always very supportive. I know, Vishnu, you've been reaching out to us whenever there's been any issue. Please continue. Please feel free. Though we may not respond immediately, we'll get back to you because we are doing our regular job plus COVID right now. So we will try to reach out to you. And we will try to do our best. But our COVID teams in the BBMP zones are very dedicated. I would like to mention that the call center works 24/7. If there's any issue, even the trivialist issue, give us the feedback so we can also improve further. There may be, because after all, we are all human beings. First day we are fine, second day we are fine, but the 10th day, 15th day, we may not be as optimally working as on the first day. So you need to also give us a feedback so we can improve ourselves. So we'll definitely try to do whatever you're given. Scheduling, actually, in fact, I remember Mr. Suman started scheduling the first meeting we had, but somehow after some time the response dwindled off, and so we were going unilaterally. But then yes, we'll reactivate the system, and you people schedule when you want, and through your forum you please reach out to all your association members. So we'll try to schedule, and we'll come when you want us. It's not like we want to force it down on you. So we are always here. Whatever support from our side, please also cooperate with us likewise. That's all my request through this forum. Thank you very much.
Sure. Thanks a lot.
And also giving a Sunday afternoon for this. Thank you very much.
Yeah, thanks a lot, ma'am, to you and the whole BBMP team, JC sir, and the whole BBMP team for attending on a Sunday evening and sacrificing your personal lives and on top of your duty and COVID duty and all. And thanks a lot for people who have attended on a Sunday evening as well. And I would leave at least few hours for a personal time. Thanks a lot and have a nice evening. Bye.